Let's start the presentation with the introduction. So, quality management or QM is a systematic approach used by organizations to ensure that their services are delivered efficiently and meet customer expectation. One of the most widely used approach is total quality management or TQM, which emphasizes continuous improvement, maintaining high quality standard and customer satisfaction. By implementing TQM, organizations can improve their performance, increase efficiency and deliver better quality service. So the first TQM concept is continuous quality improvement or CQI. This concept focuses on continuously improving healthcare process, service and overall performance. In the Ministry of Health, CQI is implemented through quality assurance program as well as regular monitoring and evaluation. This helps identify weakness and improve the quality of healthcare service. The second concept is patient focus and satisfaction. Patients are the main priority in healthcare service. Therefore, the Ministry of Health focuses on improving service accessibility and patient safety while encouraging patient feedback. This effort helps meet patient expectations and increase their overall satisfaction.
On this slide, I will explain two important features of Total Quality Management or TQM in the Ministry of Health Malaysia. The first feature is employee involvement. TQM encourages all employees to participate in decision-making and continuous improvement activities. This helps create a sense of responsibility, ownership and accountability among staff. Employee involvement can be achieved through quality circles, cross-functional teams and feedback systems, which allow healthcare workers to share ideas and contribute to improve the healthcare services. The second feature is process management. This focuses on continuously improving healthcare processes to ensure services are delivered efficiently, safely and consistently. In Ministry of Health, process management is implemented through quality management systems, SOPs, clinical guidelines and performance monitoring. These practices help reduce errors, improving patient safety and ensure high quality healthcare delivery. In conclusion, employee involvement and process management are essential components of TQM that helps the Ministry of Health to provide effectively reliable healthcare services to the public.
So, for further explanation and discussion, I would like to introduce one of the policies that made by the MOH, which is the National Policy Quality in Healthcare. For the background, it was developed by the Ministry of Health with the support from the World Health Organization, and it has been developed through the research, data collection and stakeholder engagement. The policy was implemented in 2022 until 2026, where for the vision is to improve healthcare services for all Malaysians and to promote continuous quality improvement across healthcare facilities. For the main strategies, it strengthens quality governance, especially in employees. It is also to build a quality culture among the employee, and it will strengthen the monitoring and evaluation system in government. So in this policy also have its own principles to all the employees and the staffs to be practiced, which is STEPA, STEEPA, which is S stand for safe, T timely, E effective, E equitable, P people centered, E efficient, and lastly A is for accessible.
Hi and good morning everyone. Today I will briefly explain Total Quality Management, or as we all know, TQM, in MOH organization. Firstly, leadership commitment is essential. Strong leaders set quality goals, provide the necessary resources and create a culture where continuous improvement is encouraged. Second one is customer focus, mean prioritizing patients' needs. MOH organization collect feedback through surveys and complaint system to improve patient satisfaction and service quality. Thirdly, performance measurement helps track healthcare quality. By monitoring key indicators, organization can identify areas for improvement and make evidence-based decisions. Lastly, employee involvement is important because quality improvement requires teamwork. Staff participation in problem solving and decision making helps improve overall performance.
So next we'll be moving on to the first case example, which I will be talking about the Malaysia's healthcare public-private partnership venture, the Medical Equipment Enhancement Tenure Initiative. Before the implementation of MIT, many primary healthcare facilities had to experience frequent medical equipment breakdowns and maintenance delays. These problems often disrupted the healthcare facilities and affected the quality of patient care. In addition, healthcare professionals had to spend time dealing with equipment-related issues instead of focusing fully on treating patients. To address these challenges, the Ministry of Health introduced the MIT initiative in 2014 through a public-private partnership, or PPP. Now let's look at how TQM was applied. The MIT initiative outsourced the replacement and maintenance of biomedical and oral health equipment to specialized concessionaires. Indirectly, this reflects the TQM principle of customer focus because the main goal was to improve service quality and patient satisfaction. The program also emphasized continuous improvement and performance measurement. Several key performance indicators or KPIs were introduced, including response time, preventive maintenance schedules, and equipment uptime guarantees. These indicators allowed the Ministry of Health to monitor performance closely and ensure that equipment remained functional and available for use. Examine the outcome. The MIT initiative achieved significant results. Between 2015 and 2016, the program generated approximately RM150 million in cost savings, representing a 30% reduction in expenditure. These savings enabled the Ministry of Health to purchase more than 4,000 additional units of medical equipment. Moreover, maintenance efficiency and KPI performance continuously improved between 2015 and 2022. Equipment downtime was reduced, breakdowns resolved more quickly, and healthcare facilities had better access to essential medical devices. With that being said, the MIT initiative has become an excellent example of successful TQM implementation in Malaysia's public healthcare sector. Through customer focus, continuous improvements, and performance monitoring, the program enhanced both operational efficiency and the quality of healthcare services.
For the case example, I will discuss the LANE initiative implemented at Ambulatory Pharmacy Hospital Sultan Abdul Halim, Kedah. The main issue faced by the hospital was the long waiting time for patients to receive their medication. Only 72.31% of prescriptions when completed within 30 minutes, which was far below the Ministry of Health Malaysia's target of 95%. This situation affected patient satisfaction and reduced the efficiency of healthcare service delivery. To address this problem, HSAH implemented the LANE healthcare approach, which focuses on identifying and eliminating activities that do not add value to patients. This initiative reflects several important principles of total quality management, or TQM, such as continuous improvement, employee involvement, and customer focus. The hospital carefully analyzed the pharmacy workflow to identify cause of delays, unnecessary process, and duplicate tasks. Pharmacy staff were actively involved in identifying problems and proposing solutions because they understand daily operation best. In addition, management used actual performance data such as waiting time records and prescription processing rates to support decision making. As a result, the medication preparation process became more efficient, waiting times were reduced, and overall service quality improved. This case clearly demonstrates how TQM principles can help public healthcare organizations solve operational challenges while increasing patient satisfaction and service effectiveness. In conclusion, total quality management plays a vital role in helping organizations deliver service more effectively, systematically, and efficiently. Through key principles such as customer focus, continuous improvement, and employee involvement, organizations can improve performance and consistently meet customer needs. All case examples clearly demonstrate that the quality management practices can successfully improve operational efficiency and service quality in the public healthcare sector. By involving employees, using data-based decision-making, and continuously improving processes, organizations can achieve better outcomes for both staff and customers.